And right now, the incentives in the system primarily aren't built around health outcomes. They're built around business outcomes.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. We're honored to have Don Taylor here on campus at UT Dallas. Don is a retired U.S. Air Force colonel, healthcare executive, keynote speaker, educator, coach, and author specializing in healthcare leadership and strategy. He's also an adjunct professor at UT Dallas and UT Southwestern Academic Medical Center. Welcome to the podcast, Don.
Thanks, Bob. Glad to be here.
Well, we cover a lot of topics here on the Business of Healthcare podcast, and sometimes I'd say we're within the guardrails, and sometimes we try to get out a little bit over the edge. And I really think this is a great opportunity since healthcare is in the news in such a profound way today that we'll kind of get on the edge here a little bit with you, Don. How's that sound to you?
Sounds great.
I know that you've got a lot of experience, a very strong background in healthcare. You've been the CEO of hospitals and organizations. You've served in the military as well as a colonel. Thank you for that service, of course. And everything you've done there has been, healthcare related. And when we hear the word healthcare today, we hear the word healthcare and healthcare system. In America, that's kind of got a bad connotation. People don't say healthcare is great. You hear a lot of bad things, that healthcare is broken or healthcare is dysfunctional. It's costly. It's not integrated. So the word's not really well respected like I think it should be. And there's a lot of things out there that are of concern. We don't know what we pay for things sometimes, pricing transparency, how we manage drugs, not always clear, insurance, how it's cost. The politicians are going to talk a lot about this going forward, but I thought it'd be healthy, really healthy, to stop and look at healthcare through a different lens. And that lens would be, what is health really all about in America? So I know you have some opinions on that. So why don't you kind of share with us those?
Thank you, Bob. I appreciate the opportunity to share some thoughts. As you acknowledged and you kind of outlined, I have a unique history, which has created a different perspective for me about the healthcare system and the sense of serving others. And I believe our healthcare system has become a little, I think it's either off the rails or it's become a bit derailed, maybe by the influence of private interest and the business elements of care. I learned, and so part of my unique experience is, of course, my service and a strong sense of purpose in serving others throughout my entire career. I share sometimes when I speak today about my unique experience in the combat area when I was the commander of a trauma hospital in Iraq. I share with everyone that experience taught me what caring is about. I didn't have a budget. I had one performance measure, which was save lives. I couldn't even find an attorney within eyesight. So we just cared for people with a diverse team from 50 different locations who were committed to saving lives and caring for others. I reflect on that today, and it took me almost a decade to really realize the special moment, the experience and opportunity I had. But today I look, why do we miss that in the greatest nation in the world? What is it we've lost? What have we forgotten about caring and serving others? I always say that I learned about care in the ugliest place in the world.
Well, you're not saying that we don't care about people that we take care of. I mean, we look at these physicians and physician leaders and nurses and all the clinical servant leaders that are out there. I believe just through experience that they genuinely want to get people well and things of that nature. But I think you're talking in a bigger, broader picture.
Absolutely. I think our system itself has become a bit distracted from some of the pressures either of business itself or the results that are focused maybe on business outcomes rather than what I believe should be the greatest result, which should be health. Dr. Don Norman describes it when he says we need to design our society to serve humanity. And he gives a great example of a camera that a camera, sometimes we get lost in the technicality and the details of building a camera, when in fact the camera's purpose is to create an image. Sometimes I believe our image should be health, but we've gotten distracted with designing the health care, the camera, and we've missed the vision of health for the greatest outcome in the nation. And right now, the incentives in the system primarily aren't built around health outcomes. They're built around business outcomes. And it's across the board. And it's from the government. It's in the business industry as well. And we're caught in a culture of people who truly want to serve.
Some of the barriers that we're looking at, if we went out to dinner and the wait person came to us and said, what would you like? And I ordered and they said, where do you work? And they ask you what you wanted for dinner. Where do you work? And we're going to get different prices because of where we work, the status we have with our insurance in healthcare. So we see situations like that. We look at, some of these different insurance issues with a lot of people not having insurance or underinsured. And, there's a lot of political discussion now about having, one-payer systems and things like that. Are you suggesting there's some remedy that's going to fix all of this? Or what's your perspective on some of these critical details that need to be addressed?
Well, we first assume that the healthcare can function well in a free market. We make that assumption. That's been promoted. This isn't political. It's both sides to talk about the free market. And we've built that system since World War II, when all of our care, most of our care, has been supported through employment. And employers then charge you, they pass through the cost, they negotiate rates with insurers. And if you look over time, the out-of-pocket personal accountability and the free market choice has diminished since that time, and it's been shifted into the insurance industry as well as government as they picked up Medicare and Medicaid to cover underserved areas of our population and our citizenry. Through that process, we've disassociated people from purchasing power or from purchasing choice. We've assumed they will not understand, and I've heard that many times. Even in this current policy that's proposed now on price transparency, I've seen CEOs quoted as saying, this can't go forward. The patients won't understand it anyway. And or it wouldn't influence their decision because they're not bearing the full price. Absolutely. Well, maybe we need to remedy that with more transparency of process.
Okay. So when we stop to think about accountability in terms of healthcare and personal accountability, we all have the responsibility to try to live a healthy life. And we need help. We need to be educated. We need to know what our options are. I've had this little acronym that I created called Everybody Needs to Join the NRA. And it's not the National Rifle Association. It's nutrition, rest, and activity. So if you could subscribe to a lifestyle where you're educated to eat good food, if you had access to good food, if you knew how to prepare good food and other nutrition, and if you got the adequate rest, sleep, all those things fit together. And if you had a life of activity where you had movement and you could, stay mobile and be moving around, those three things might contribute to an accountability for an individual. Now, when we start to bring that accountability out to organizations, how do we help people, all these different social determinants of healthcare? There's a variety of things. What are your thoughts and perspectives on how that can be a difference maker?
Well, let me put it in the context of the way an individual today is exposed to the system. First of all, we never see full pricing. Even when seen, we don't really understand because we haven't been taught that. We also have an expectation of quality or value in whatever we purchase or whatever our agent, whether it be insurer or employer, purchases on our behalf. And by the way, either one, we still are paying that full price. And that's the part people understand. Nothing's free. We all are paying all of those things in one way or another. It's just not transparent to you entirely. But the other element is of course quality. And where are we in purchasing, or how do we evaluate quality? There's practically no transparency of quality. You see quality process, but we aren't measuring and sharing outcomes. We need to know that as well. I need to know the likelihood of a successful outcome for something I have engaged in or agreed to engage in. And we don't know that, and we can't tell that variance. Mostly we evaluate through ZocDoc and some online things about the experience itself, admittedly maybe a little empathy from the provider, but we miss all of that.
What was ZocDoc?
ZocDoc.
ZocDoc.
It's a base system where people go out and evaluate doctors based upon their personal engagements.
Okay.
And it's a star rating, and you do that. And
Kind of like on Amazon when
Absolutely.
you get a product review.
Absolutely.
Okay.
Which is kind of a precursor, I think, to where healthcare will end up going. But I would love to see objective measures of quality. And then beyond that, I would go into the access issues. Sometimes when I speak and I teach, I talk about comparing healthcare to purchasing a truck. And I say, when's the last time you had a hard time getting into a dealership to buy a truck? And they go, well, never. They usually flag you down. Well, is it the same for your provider? Oh, and then after you arrive, do you get the free cookies and the back rub like Mercedes offers? No, it's not quite like that in the waiting room. I just think we need to begin to understand what a free market is about with informed choice. So with that, actually, it was during the strategy class, and I was talking with some of your students about the Medicare for All proposals that are being promoted today in our society and offered in an election year. Things get pretty exciting. And I thought, let's talk about the practicality of ideas. Let's talk about truly what we're trying to achieve. And it's very clear to me from my own experience, health is the desired outcome we want, or so we think. However, is the current healthcare business incentivized to create health? I don't believe it is entirely today because there's little value in achieving health in today's system. There's value in sickness. There's just not value in health. So as I was sharing ideas, I paralleled this with some other things that I've experienced and how it would align as a federal government's responsibility.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
Okay, so we talk about health. We always think about situations where we may have a chronic illness or we may have an emergency situation. The other thing that's in the news a lot today is 2 words I don't like to hear, and that's mental illness. You don't go up to somebody and say, how's your mental illness? And I would recommend choice of words is probably pretty important in a lot of things. And how's your well-being? And that's got to be a component as well of our overall health picture.
Oh, absolutely. And it's becoming a greater element of what I call health in the nation. So let me go back to the debate that I have, and I love having this discussion with peers and with students, is what is, and I challenge them, do we have a right to health care in itself? And I offer that maybe we as a nation have a right to health, not necessarily health care. I differentiate the two. So the nation has a responsibility to provide what I call as a right to life, a right to safety, security, and a right to well-being in the nation. Last time I checked for my military days, we're pretty safe.
That's what the nation is supposed to provide.
That's the nation's supposed to provide.
What are those 3 things again?
Oh, and that would be right to life.
Okay.
Right to well-being and safety. I also say well-being becomes an element of health. So if the military provides you security, skies are clear, we're a prosperous nation, you can speak freely, you're not judged based upon, by and large, your appearance and your opportunities. We're a nation of great value in sharing, but we're safe and secure and free to make choices. But we aren't healthy. We're 28th in the world in life expectancy. We're 31st in infant mortality, but yet we're number 1 by a long shot in expenses. We have every opportunity in the world to be the healthiest nation on the planet. We just haven't created the opportunity for that. So I would put this on the side. Let's just say, let's do something different. In 1965, the government decided that after employment was becoming the way to achieve health care in the nation, the uncovered were those that were poor and those that had retired. Medicare was born. Medicaid was born. We still are missing an element of health for the nation. I've proposed an idea called MetaHealth that would be a platform system sponsored and offered by the government to provide health to everyone in the nation. Sort of leveling the social determinants. We all start in different places. What you talk about in nutrition and you talk about your NRA process, your NRA proposal is absolutely true, but you have had unique knowledge and abilities to understand that.
Yes.
We have a good portion of our nation who doesn't understand basic nutrition. How to navigate our health system. Literacy. What do terms mean? How do we communicate with those? And how do we start with children? We were talking children's books here before the show. What if we had something that helped children understand the value of health for life and give them access to health knowledge, power to choose, power to make self-determination?
I think we're going to see some of that with this generational move. Quite frankly, Don, you and I we're at that category where they start to thinking about calling us seniors. Okay. but the millennials, the oldest millennial will be 40 years old next year. Okay. But when you stop and think about their value system and how they perceive health, I think there's a generational movement for opportunity to do these types of things, to do the education, to make new systems available and make access different than we have had in the past. For right now, you can order your breakfast, lunch, and dinner and have, somebody deliver it to you in about 5 minutes. And I think that will start to roll over into healthcare attention as well, I would hope.
Correct. Because the business opportunity will be there. But I challenge, will that generate health? Will that generate the sustaining value we're trying to achieve as individuals, helping individuals achieve their own potential, their own unique potential in life? And that is best served by being healthy first, with healthy choices and wise decisions. So this proposal would be prevention ideas. It would be health equity across our system where that's unequal based upon your own demographic and your own history. This would be rural urban. It would also be health literacy. It would be mental wellness opportunities. It would also be navigation of the system, teaching people. We've really failed in teaching people how to navigate the silos between the health system. The other elements of that, like transparency of the electronic record, Apple's trying to make it available to every platform. As that becomes more available, a common idea of health will be practical. And I believe then and only then will we get what I call a balance of the cost, of the quality of care and the access to care.
Yes.
I also would have this also recognize end of life opportunity. We shouldn't wait till you're on your deathbed for other people to make decisions about how you want your end of days. I believe death, a well-planned or a well-determined, predetermined death is part of health. And we should try to capture that and educate on that earlier in life when people are able to process the information. So this will be a comprehensive process for all of it.
We had an author submit a book to us, and he's a leading expert on planned exit. And it was a little bit too sensitive for the podcast. So we said, we'll check back with you a little bit later on that. But, that is from your birth to your death. Health is going to be the key element of your entire life. I'll share recently, I had a family member have an emergency situation in China. And so I had the opportunity to see the Chinese environment work differently than ours. And from a social media perspective, in China, all of your health records are delivered to you through the academic medical center and through your physician through a social media app called WeChat. And there'd be like Facebook here. And there is no HIPAA. There are no requirements to hide information like that. And that information is just easily and quickly shared. And because of that, people are not alienated from the information. They don't have to go somewhere to get it and to access it. They get it just like they would ordering their food. And so it becomes very much a part of their life, that information. I don't know how that policy will ever change in the United States, but having consumerism kick in to become more real in everybody's life And consumerism is really what? Making choices and decisions and being educated in those choices and decisions. Your thoughts on that?
Oh, absolutely. We're headed there. I mean, the Amazon model of purchasing care is real. I believe you will see a relaxation of the privacy issues as the generations change. You and I have a different view of privacy than my children, and the next generation has much less. I mean, for goodness sake, look what they post. So their healthcare experience is free to the world in most cases. And I have found that through my students when I talk about this. They're going, why all those privacy barriers? I mean, we trust them. We're okay with that. I believe what I just described a moment ago through this mental health has resonated with a lot of the younger generation. But somehow, as they enter healthcare, they lose this what I call the higher calling of care. They lose this purpose of focus on health. In med school, it's lost in the third year. It's already documented through research. Empathy is diminished in the third year of school. That's when they start clinical rotations and they start experiencing health care, the business, for what it really is. Mm-hmm. And they lose this higher level purpose. I think we have to restore that. We have to restore that as a nation. We have to navigate some of the business challenges we have in healthcare today. We need to let people be healthy. And then if you make bad choices, okay, then you're accountable to the free market and you pay premiums for bad health choices. But it's not because you didn't know. Everyone will know.
So let's talk about physicians just for a short while. We have a program here at UT Dallas. It's in its 22nd year, and it's the Alliance for Physician Leadership. And we bring in physicians from around the country. There's a 2-year waiting list, over a 2-year waiting list to roll in the program. And we're really trying to develop leadership skills with these physicians. And I think just like most major cities, they have a Chamber of Commerce and they have a leadership program. There's Leadership Dallas. Here in Richardson, where the university is located, it's Leadership Richardson. And people are selected to be part of a leadership program. They join the program. It's a 9-month program. It's one Friday a month. And they come in to learn skills and knowledge and capabilities that'll help them become leaders in the community. And I think we need a medical leadership program or healthcare leadership program designed in the same fashion for, clinicians, administrators, and others, where they can come in and learn about leadership skills, competencies of leaders, strategy for leadership, learn negotiation, emotional intelligence skills like that. And with that, you start to get a broader spectrum of outpouring knowledge so that we can make these changes take place. And I think that some of the ideas that you shared here help us start to formulate the elements of change that need to take place. Disruption's on the horizon, right?
It is. It's throughout the industry. But I believe the disruption isn't founded in achieving health. It's founded in trying to capture the $1 trillion of waste that's embedded in our system. That's at least what I'm seeing from most of the disruptor entities entering the market. They're disguising it through technologies and other things, but it's to advance a lot of business. I'm looking for some way to advance health, which isn't current in the business models of value. And that's where I believe the federal government has a responsibility. The resources are already there. They're allocated to the states. They just need to be optimized. So we focus them and we standardize across the nation.
Right. Okay. Like I said, we're going to try to get on the edge here a little bit today. I think we did. I don't think we fell off, but certainly a discussion that merits more discussion in larger and larger groups. And the purpose of our podcast here is to not only inform people, but also to help educate and provide a forum where we can have more interest and more discussion on these critical times. So this year is an election year. A lot of things are going on. We'll all stay tuned to see what comes forward. Healthcare is a major topic. Solutions are on both ends, sometimes profound and distinct and sometimes reserved. And everybody has a new opinion on it. And how fast things change in our healthcare system. In the past, it hasn't happened very quickly. But I think that the acceleration of this world we live in with the Internet of Things will certainly drive us forward. So any final words here, Don, you'd like to share with us?
No, just to say, I think if we keep health as our North Star, we will make better decisions regarding the healthcare system.
I agree.
Keep health as the North Star.
Well, thank you, Don, for joining us here today. We appreciate it.
Thank you for the time.
Thanks for listening to the Business of Healthcare podcast.
Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.